This presentation is going to cover the content that was covered on Friday. We had many students that had to miss because of the weather and just the inability to get to campus, and also child care issues. So I'm going to run through this kind of quickly, but to give you a basic idea of what we covered. One of the things that you need to make sure you do before you start this presentation is to actually get the concept maps downloaded and printed. They're in PDF format, so you should be able to print those off from pretty much any computer. Once you've got those, then you'll be able to follow along when we come to those particular slides. One of the first things we need to talk about with cancer are possible causes. Clearly, genetics is a major factor, and we're learning more about that as we go along. But if you've got a first-degree relative or a second-degree relative that has had cancer that was less than 50 years of age, you're at potentially higher risk than others who do not have these same relatives with the same situation. Keep in mind your first-degree relatives include things like siblings, parents, and offspring. A second-degree relative is your grandparents, your aunts, your uncles, or a grandchild if you've reached that age. We also know some other causes are environmental factors. Chemicals, toxic substances that we're exposed to. We find those not only in our workplace, but sometimes in homes with products like radon gas that got a lot of media attention years ago, was a suspected cause of cancer, a known carcinogen. We have other things, though, that are in our environment that we need to take into account. Mechanics from years gone by, when brake pads had asbestos linings, brake drums had these asbestos brake pads in them, they were constantly being exposed to these types of materials. You'll notice down here too the ship plumbing system there that's covered in asbestos insulation to protect people from heat and exposure to those pipes. As that material breaks down and those fibers get into the air, these people develop cancer over the course of exposure long term. So we need to be mindful of our patients' backgrounds whenever we're doing our initial history and physical on them. We need to be asking about what kind of labor they did. Maybe they were just a housewife that was exposed to the laundry from one of these individuals, and as they're shaking this stuff out, they're releasing this asbestos fibers back into the air. Alcohol, very specifically in the news here lately, we've had some prominent people that have developed certain types of cancers that are linked almost exclusively to those who smoke and drink alcohol. Diets high in fat are an indicator that we may have a potential problem and be potentially at risk for cancer. So that's something we need to assess on our patients. Keep in mind, when we talked about this with the GI content, but that fat food is cheap food. We don't get fruits and vegetables, typically for $1 like we can a ramen noodle or a can of SpaghettiOs or something like that. So these high-fat diets predispose a certain portion of our population to this greater risk. Keep in mind, men are at the greatest risk of cancer, but our African American females are at the greatest risk of death. We have to really take in and look at that and try to figure out why. And the easiest answer, I think, is that the socioeconomics of the situation. They don't have good insurance. They typically live longer than their counterparts, so they may have lost health care insurance at an earlier age and not had the preventative care, the yearly screenings, the monthly screenings that they needed to have, simply because of the cost. Now, some of the screening, of course, is free, but how high on these people's priority list is this? I mean, if we're trying to support a family or kids, or we're trying to work, and like you guys trying to go to school, how much time do you actually have for self-care? We know from our reading that viruses can also be a problem, especially Epstein-Barr was one of the ones that was mentioned. Don't waste a whole lot of time on that, but just know. Also, immunological defects can lead people to being predisposed for cancer, so our body doesn't naturally recognize the abnormal cell growth and send the signal to kill that cell. When we look at detection and prevention, clearly there's several things we need to be working with our patients on. And so as we encounter our patients, especially if you work in a clinic setting and you see them multiple times throughout the year, you need to be holding them accountable. Just like we weigh them every time they come in to the physician's office, we need to be asking how much progress they're making toward programs like tobacco cessation. How are they doing as far as physical activity? What changes have they made to their diet since the last time you talked to them? Some of the easiest things we can do is stay away from tobacco. They also need to stay at a healthy weight. That's very difficult again with the quality of foods that people may be intaking and with demands on their life, how much time they actually have for physical activity. We need to work with them and see if we can figure out how to make that a little easier. We want to encourage them to eat healthy and to eat plenty of fruits and vegetables. And when we talk about that, just like in the GI content, remember we may have to suggest canned fruits, canned vegetables. The sodium content tends to be a little higher on them, but they at least still get the fiber in their diet that will help with colorectal cancer prevention. And so we need to kind of think outside of the box sometime. How can we get our clients easier access to healthier foods? And again, just like we talked about in the GI content, you need to look back and kind of be familiar with initiatives like Walmart that they're undertaking right now to try to make healthy foods cheaper. We need to encourage them to protect their skin, so especially if we're dealing with that young adult population, we need to make sure that they're using sunscreen, hats with wide brims, sunglasses to protect their eyes and their skin from the constant UV exposure. We need to encourage them to know themselves and to know their family history. A lot of times as our parents died, especially if our grandparents died, depending on our age, we may not really know what they died of, but we need to start being a little more inquisitive and finding out, hey, did they die of lung cancer? Did they die of pancreatic cancer? Because these kinds of things are going to be important, especially when we look at cancer screening tests. We also need to encourage them to have regular checkups as they see the healthcare provider and encourage them to do monthly self-exams if indicated. Some of the secondary prevention methods that we have out there include like a pap smear. Women should begin having a cervical cancer screening about every 3 years after having 3 years after they begin vaginal intercourse, but no later than 21 years of age. Screening should be done every year with a regular pap test or 2 years using the newer liquid-based pap test that's out there. Beginning at age 30, women who have had at least 3 normal pap tests may decide to get their pap done every 2 to 3 years. Women older than 30 may also choose a little different testing guideline there. Women over 70 years of age who have had 3 or more normal PAPs in a row with no abnormal PAP results in the last 10 years, they may simply choose to stop having these exams done. Colonoscopy. We need to encourage anyone over the age of 50 to get that baseline colonoscopy. Not everyone is so willing to have that done for obvious reasons. So we can do some negotiating here. If you've got a client that just absolutely refuses to have a colonoscopy done, one of the things that you might suggest is a fecal blood occult test, so that you can take and spear the stool and basically have an agreement beforehand that if you find blood, that this patient is going to have to go ahead and have something else done. They've got a couple of different options. Traditional colonoscopy, we only have to do that once every 10 years, so as far as the discomfort of the test, they actually get a pretty good time return on their investment there. If they opt to have the flexible sigmoid scope, now remember that's the shorter one, that one needs to be done every 5 years. They can also have a double contrast barium enema every 5 years, or they can have a CT. Sometimes it's referred to as a virtual colonoscopy every 5 years. And again, for those that are refusing these types of tests, we need to have at least a yearly fecal occult blood test run, with the understanding that, again, that if they come up positive, that they're going to actually have to have one of these other procedures done. Breast cancer, we need to be encouraging our yearly mammograms. We need to be encouraging the monthly self-exams, breast self-exams in these women starting in their 20s. It gives them a baseline of what the underlying structures feel like. And again, the earlier detection, the better our chances of survival. Prostate cancer,